Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be with us for this next segment. I have the excellent Dr. Ryan Lehr, dentist here in Monterey. Dr. Lehr, thank you so much for coming on the program.
Thanks for having me again.
Dr. Lehr, once again, I have to admit, I love these segments where I learn a lot, and I want to learn about advances in dentistry, and particular, I want to learn about aligning teeth.
Okay.
Right, and alignment and new therapies, etc.
Well,
so before we get into that, let's briefly talk about you. And I understand you have roots here.
I do.
And I want to talk. So you're located here in Monterey.
I am.
Where'd you get your dentistry training?
Creighton in Omaha, Nebraska.
Excellent. And then you joined a practice in Redding, California.
Yep.
And then you're here back in
the Monterey Peninsula Dental Group.
Excellent. And before we say thank you for viewing, we're going to give out your phone number, okay?
Perfect.
Excellent. So Dr. Lehr,
yes.
I want to know all about this. Well, what do we mean by dental alignment or realignment?
Well, so patients will come in, and especially particularly adults who, never had the opportunity to have their teeth properly aligned, okay? And so, you see a new patient, first thing you're going to look at is you have recession, we have wear and tear, we have a lot of things that seem to have gone wrong at some point, okay? And really, the root of the cause is misaligned teeth, okay? And so we got to go back and say, well, you never had braces. You never had the opportunity to have braces. And you talk to patients about aligning teeth and they assume metal mouth, they assume braces, brackets. They don't want that. So the opportunity now for them to do so and have their teeth properly aligned without braces using aligner therapy has come out, and it's been perfected over the years to the point where now we can properly treat patients and get their teeth in the right alignment for their dental health and systemic health as well.
Excellent. Well, Dr. Lehr, I do, as a plastic surgeon, I do facial fractures and mandible fractures, maxillary fractures. So I oftentimes will be concerned about occlusion. Right? So could we mention the three different common classes of occlusion? Right?
There's class 1, which is our most common, but there's class 1 malocclusion, where the teeth are, the skeletal, the lower jaw and the upper jaw are technically in the right place, but the teeth are misaligned. But then there's a class 2, which is a retruded jaw, and then there's a class 3, which is a protruded jaw, okay? And so the kind of, treatment we're talking about now is more class 1, because we're talking about developed, adult teeth that have already, the mandible's already caught up. We've already gone past the late stage mandibular growth, and so we're talking about class 1, fixing class 1 patients and getting their teeth properly rotated, properly aligned for long-term dental health.
Okay, so when you talk about dental health, this is more than giving people pretty teeth.
Right.
Although a side benefit or a benefit could be someone has a more attractive smile, but it can actually affect dental health, correct?
That's correct.
Okay, so let's say an adult comes in and they have, their teeth come together okay, they have class 1 occlusion, but they notice that their teeth are not well aligned.
Right. Well, it's sometimes not as apparent until we take pictures and show patients kind of the wear and tear and what's happening along the way. Most people have understood the idea of receding gum lines and, recession, and we have abfractions, which is actually where at the gum line where the tooth, part of the tooth kind of breaks off, and we have these little gaps that form. And so part of the problem is that with the teeth being misaligned, we're not biting down with the correct vertical forces, okay? We're biting down with horizontal forces, which isn't what the teeth are designed to do. And so what we want to talk about is, let's get you back to an ideal state where you're biting down with these vertical forces. And we are going to stop future wear and tear on your gums. We're going to stop and lessen, the idea is hopefully lessen some of the periodontal pocketing that's going on and help make your teeth healthy so that when we do future dental work, we're giving you the best opportunity for long-term success.
Okay, excellent. So Does this mean that adults get braces? Do they get retainers? Do they get so-called tinsel teeth?
Right.
So how do you go about this?
So braces are still a great option, but there's a better option for minor tooth movement, okay? And I actually brought some models here. So here we have a upper jaw, lower jaw. And what you'll notice here, these are called aligners, okay? And so what happens is a patient puts the aligners in, and the teeth slowly move, okay? They move about 0.2 millimeters for each aligner. And you go through a series of aligners over the course of your treatment. And at the end of treatment, your teeth, we know the outcome before we start the case, which is the best part of it all. We do what's called a CLIN check, and we can the computer generates the model from our impressions, and we can manipulate the teeth prior to starting the case. So just like you would prepare for a surgery, and you tell the patient this is the expectations, we can say, here's where your teeth are now, here's where your teeth are going to be. And so now we're showing patients, before we even begin, this is what the outcome's going to be. And so we're going to know how we're going to succeed and if we're going to succeed.
Dr. Lehr, this is amazing. So when we talked about when you talk about Invisalign,
right?
So that's different than the sort of silver brackets that I think of as being braces, right?
Right.
So they're not so visible. Is that correct?
They're the idea. It's in the name. It's pretty much it's pretty much like a clear bleach tray, so you really don't see them very well. If you're up close within a couple of foot of the patient, you can tell that there's something in their mouth, but the idea is that they're pretty much invisible.
Okay, so this is fascinating to me. So how often do they wear them? How long do they wear them? How long does it take? Is it permanent? Is it temporary?
Right.
Etc. I want to know the details.
Okay, so
let's teach our audience.
Let's just go over it real basic. Okay, you come in, the actual little trays, and these are called aligners. Okay, you go through a series of these, and depending on the amount of movement, will kind of determine, and the types of movement, if we have rotations, if we have protrusion, if we have intrusion, extrusion. There's all these fancy terms, but basically if we're moving the teeth a lot, treatment's going to be longer. If we're moving the teeth just a little bit, just to get things fine-tuned, it's a shorter treatment. The trick is, because they're now removable, which is both good and bad, the good aspect of them being removable is now you can floss your teeth and keep your hygiene standards at the level that we expect, so you're not going to get the puffy gums you see with teenagers wearing, braces. The issue and the drawback is, you go to a dinner party, and all of a sudden you take your aligner out and you forget you took it out, and you've gone hours and hours without your aligners, and all of a sudden the teeth start to fall backwards into the position they were before. So you need to keep them in all the time. It's pretty much 22 hours a day. You take them out to eat, you put them, and then you brush, floss, you put them back in.
Okay, so Dr. Lehr, you said the time can vary, but are we talking about 10 years,
We're
10
talking,
days, 10 months?
Right. And I would say with my, with a class 1 patient, which is in kind of pretty standard occlusion, things are slightly off, we need to tweak a little bit, you're looking at anywhere from 6 months to probably about a year and a half.
Okay. 22 hours a day.
22 hours a day.
7 days a week.
7 days a week.
Okay. Does it hurt when they're on? Is it uncomfortable?
Patients get really used to it. What we found is the first couple weeks is uncomfortable, because just like if you were to go to the gym and do some exercising, you're going to be sore the next day if you haven't been doing it a lot. But once you condition, and once the tooth movement starts, and we have the osteoclast, and the osteoblast, the builders and the destroyers working together to move the teeth through the bone, once that starts to happen, the teeth, you kind of get used to it. And so your body adapts and it becomes less uncomfortable.
Okay. Now, is it permanent? Let's say we get the result we want. It has taken 6 months or 12 months or 18 months.
Right. And
we get the change and the shape and the relationship of the teeth that we want.
Right.
So Do they put it back on every once in a while? Is it a permanent change?
This is a good question. So once you're done with therapy, you would go into, just like anybody who goes through traditional brackets, braces, if you will go to a retainer. That's the next step, okay? So we have patients in retainer after they're done with their Invisalign treatment. So say they're in treatment for 6 months. They would then wear retainers for, say, 18 hours a day for about 6 months, just to get the teeth stable, to make sure they're not going to move. Then you go to wearing your retainers at night. And then eventually you can wear them every other night, Monday, Wednesday, Friday, just to make sure you kind of keep the teeth stable. But it's the same post, treatment that you would do with traditional braces.
Okay. So how often will they come into your office to get a new, do you call it an aligner?
Aligner, yeah.
How often do they come in to get a new aligner?
So the beauty is you can schedule, if it's every 2 weeks, you can basically work around the patient's schedule. So if the patient is really, really good about wearing their aligners, and you trust they're going to be wearing them 22 hours a day, you can schedule them for a month and a half, 2 months, 3 months out, as long as it's not too complex of a case. If it gets complex, you want to see them more regularly, but otherwise you could see them 2 or 3 times and they're done with treatment.
So 2 or 3 times over the course
of 6 months, or if it's a year long, you might want to see them every 2 months for checkups. But you're just making sure that things are properly fitting. They come in, you give them their new aligners, you check the fit, and that's it.
Okay, so Dr. Lehr, unfortunately we only have about 90 more seconds.
Right.
I'm fascinated by this. I want to learn more about it. Did you hear that? Jim and Mary Lou, I want to learn more about this. So they come in 3 or 4 times, perhaps in 6 months,
right,
and it might take a couple weeks to get accustomed to it.
You're right.
Okay, so what about children versus sort of the adolescent,
right,
versus the adult? Can children or the adolescent?
Right, everybody's a candidate. They have a different program for teenagers with a maturing dentition where, we have permanent teeth coming in. So everybody's, able to do Invisalign treatment. It's just a matter of whether or not they're going to be compliant or not. And compliance is the biggest issue.
Okay. Now, before we give out your contact number, Dr. Lehr, I just want to mention something I read in a magazine or saw on the internet, that in some upper grade school classes and high schools, that's kind of hip to have braces again. I mean, the kids aren't ridiculed or bullied. It's kind of hip to have braces. I think it's fascinating.
I think people are realizing the importance of getting teeth properly positioned.
Dr. Ryan Lehr, you're a dentist here in Monterey, California.
That's correct.
We've talked about dental alignment and we've talked about Invisalign. I learned a lot today. Okay, can we give out a contact number for you?
That's perfect.
Let's see, Dr. Ryan Lehr here in Monterey, California, 831-373-3068. 373-3068, Dr. Ryan Lehr. I learned a lot. Dennis, I hope you come back on the program.
I'll be back.
Thanks very much for being here.
Thank you.
Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon. I have over 20 years in plastic surgery. I'm here in Monterey. If you want to learn more about dental alignment, please call Dr. Ryan Lehr. If you want to learn more about spine surgery, please call Dr. Mark Howard, or you can call me to learn about plastic surgery. Dr. David Morwood, and this is Your Health television program. Thank you very much for tuning in.